Welcome back to the Elle-Sera podcast. And today's guest, we have aesthetic doctor and assistant professor at University of Nottingham, the lovely Dr Keiron Lord. How are you?
Good, thank you.
Thank you so much for being here. I'm going to make a personal question to start with. You are now obviously an aesthetics doctor. That is your level of expertise. It's where you're most comfortable, but you were a gynecologist once upon a time.
Yep.
Why the change from gynecology to aesthetics?
I've kind of always done both.
Yeah.
So actually the aesthetics thing has been going on for years, just kind of in the background. And if I'm being completely honest, it was never about, when I was at med school, the drive was never, I want to be an aesthetics doctor. It was a surgeon of some sort. And that kind of went down the obs-and-gynae route. The aesthetics things, if I'm completely honest, was I was a junior doctor. I had friends and family who were having the treatments done. And I thought, why are you paying those people? Why don't you pay me and I'll do the treatments? Okay. That's kind of how it started. And then it kind of built up alongside the other job. I started doing my obs-and-gynae work. Really enjoy it. Still do it now. I still do probably one shift a week at the moment, purely out of, I just enjoy it. But it has allowed me to then build up the aesthetic side a little bit more. And they work well together. It allows me to have the flexibility, which I enjoy. And it allows me to take the bits of the obs-and-gynae NHS work into the aesthetics side. And it just works really well. What's
the main recurring theme? What's the one thing that you're like, right, I knew that from gynae and that's what I'm putting into practice when it comes to aesthetics?
I don't know. I think it's more it's not really a treatment or anything like that. It's more about the consultation process and the way you kind of treat your patient or your client. And it's kind of the whole ethical bit and trying to just make sure that whatever they're having done is the right thing for them.
No, absolutely. Tailoring an experience has become the new norm in the world of aesthetics. It used to be like, you'd go in for your 3 areas of Botox, and now it's a completely different ball game. People are going in, there's a more tailored approach. Why has that changed? What do you think is the main catalyst between people wanting something different now?
I think people don't want to all look the same. I think people have noticed that everyone's starting to look the same. A lot of celebrities are morphing into the same person. If you look at certain Instagram accounts, you'll see different people all with the same lips, and you'll see a 20-year-old that's got these big lips, and you'll see quite clearly an older person who's got the same lips, and it doesn't work for everybody. I think there's more awareness of that going on, people wanting to not look all the same. I think there's more of an awareness of different sort of treatments, sort of regenerative treatments, and I think there's a bigger drive now for people wanting more of an anti-aging treatment rather than something that's going to change them. They want to look like they did 10 years ago, not look like a different person.
Yeah, that was quite big. I remember, must have been probably about 10 years ago now, there was an amazing program. It was like Botched. Yeah. And I used to love watching it because you'd see these people walk in and they'd have the cheek filler and they'd have some form of implant going on in their chin. They'd have it, and we were looking at it and it was very bizarre, very almost like alien, like, oh my God, look at what they've had done. But I suppose we're all a bit desensitized to it now because it's becoming a bit of a new norm, and you see quite a lot of celebrities are going to real extremes. Obviously, you've got at the moment in press, the ever faithful Katie Price. What are we on, the umpteenth boob job and things like that. People are now opting. Once upon a time, they used to go in and say, that's what I want to look like. I want that Katie Price look. They're now opting to look far more natural. And so what are the treatments now that are differing from perhaps when you were going in and saying, I want to be completely pumped full of filler? What are those treatments now looking at?
I think filler's still got a place. So I think there are still people, when people say, fillers are going, no one's having fillers anymore, all these celebrities are having them dissolved. I don't think they're having them all dissolved. I think they're having some of the bad fillers dissolved and having subtle amounts of filler put back, because there's no way of replenishing that facial volume loss without using fillers. So I think fillers and toxins are always going to be part of the treatment program, but there's a lot more science behind treatments now. So there's a lot more treatments around boosting collagen. They've been around for years, but it's getting a lot of traction now. So things like your polynucleotide treatments, PRP treatments, things like that, which are going to just bank that collagen. We all lose collagen as we age. So actually there's now an awareness of let's improve the amount of collagen we've got and maintain that so that our skin keeps looking healthy.
Collagen, we get loads of questions about collagen. Obviously, they always want to ask. Elle-Sera is usually the go-to when it comes to the recommendations of collagen. Why is collagen so important, and what is the impact that it has on skin or on aging or in certain phases of life such as menopause?
Yeah, we get it a lot in the clinic. We get a lot of questions around collagen, which supplement to take, because they can be quite expensive and things. And but there are a lot of benefits to taking it. So collagen is essentially the structural element in your skin. It's the scaffolding that holds everything together. You've got your collagen on one side, you've got your elastin on the other. I say collagen, as I said, is your scaffolding. It kind of holds things where it should be in the skin. And your elastin is that recoil. So when you smile, you get lines, but when you stop smiling, it snaps back. As we age, collagen depletes. So from around the age of 25, you lose about 1.5% each year. And in that first 5 years of menopause, you lose 30% of your remaining collagen. So it's a huge amount. And the cells that make the collagen in your skin, which are fibroblasts, just start to shut off. So unless you're stimulating them or you're providing collagen in other ways, it won't work. And that's why there's a lot of now work around how we stimulate collagen in the skin, how we produce more collagen, and how we store it.
And how do we stimulate collagen in the skin?
There's a few ways of doing it. So supplements are one way. Actually, modifying your diet is equally as good, and actually just taking the supplements alone won't do the job. So make sure you're eating collagen-rich foods, so your meats and things like that. Having a dietary supplement is beneficial if you're using the right one. There's not a single brand, but there's certain things to look out for in terms of molecular weights and things like that.
And what are they?
So if you look at collagen, you have marine, bovine, or plant-based. Generally speaking, the evidence seems to suggest that the bovine and marine are better than the plant-based alternatives. And also it's your molecular weight. So a lot of the products actually don't say this. You may have to go and do some digging or even ask them. But you need the molecular weight to be 6 kDa, so kilodaltons or less. The reason for that is when you eat collagen, your body, or eat anything, your body breaks it down in the stomach. If it's too big that your body can't absorb it straight away, it'll break it down and then absorb it. So if you spend a lot of money on these expensive collagen supplements, but they're bigger than 6 kilodaltons, goes into your stomach goes, I can't absorb that. It breaks it down into amino acids, absorbs it. Some of those may be made back into collagen, but a lot of them might be used for other things like muscle and things like that. So you're not getting the benefit of it. Alongside taking your supplements, if you're really trying to focus on skin health, it's the treatments we mentioned earlier. So polynucleotides are really great. They are injectable treatments that boost mostly type 1 and type 3 collagen in the skin. And because they're injected directly into the skin, you're going to see maximal benefit there. There are other things. So Pro has been around for years. I've been using it for about 5 years. That's an amino acid replacement. So you're kind of giving your skin the stuff it needs to make the collagen. And then things like PRP. But again, that depends on your diet and things, because so many people have PRP, which is, you take your blood, you centrifuge it, you put the good bits of your blood back onto your skin. And it works really well. But if your lifestyle's rubbish and you're not sleeping well and you're eating rubbish and you're drinking a lot of alcohol, your blood isn't going to be good enough. So then you put it on the skin, it doesn't do anything. So there's many things that contribute.
I think it goes back to that time-honoured phrase of you've got to look after your body from the inside as well as on the outside. We get it quite a lot. You can take all the supplements in the world until you're rattling, but if you're putting the wrong foods in, or you're smoking 40 a day and you're drinking heavily, or you're drinking lots of caffeine, they will all, at some point there'll come a time where they will impact how you look and feel. Do you find a lot of people that come to you and think, having aesthetics is just going to be a quick fix, and they're not really wanting to do the work internally? Or
yeah, and there's not a lot of work you have to. It's not like there's a lot of, I'm not going to say to somebody, don't stay up late, don't drink alcohol on a social occasion, don't have that takeaway or whatever, because people enjoy things like that, and that's fine, but it's everything in moderation, isn't it? But it's about educating people around that and saying, look, these will help to some extent, but actually let's have a look at the other bits as well. I've had people come in before for skin boosters, and when I've asked them what skincare products they used, nothing. I said, no, what, like moisturizer? No. Basically a bar of soap, wash my face, and that's it. I said, but you're going to spend a lot of money on these skin boosters. Why don't we think about getting you a skincare plan? No, I just want the skin booster because it's a quick fix. And I think that some people are like that, but a lot of people actually do think, I'd rather look at it a bit more holistically. We
see quite a lot of adverts, especially in the world of Instagram, Facebook, that are genuinely that quick fix. I took this supplement and within 3 days, grew an extra head, something like that. It's ridiculous, like the statements and claims that people can make, especially when it comes to aesthetics and supplements. We've had this conversation quite a lot. They're not regulated. And so quite a lot of the statements that you can see out there, some of them are pretty shameless. They will genuinely say, like, you can have this injection today and you can be, 14 stone less tomorrow. And there are people out there that know logically that can't work. But what's the one at the moment that you're really kind of against when people are saying, quick fixes? What's the one where you think, as opposed to doing this, these are the simpler steps that you could be taking?
I think there's a few things. I think there's, in terms of health and sort of optimizing health, I think it comes down to, there's so many things that aren't quick fixes. Mm-hmm. There's so many supplements that I think probably, as you said, people take supplements and think they're going to work better, and actually because they're just taking a one-off thing, they see an advert online and go, oh, I'll take that. They don't know if that supplement will work. They usually make claims about the thing rather than the product. So they'll go, magnesium helps with sleep and all that. Yeah, it does. Does your product help with that? Might not. I think one of the big ones at the moment actually is the weight loss injections that are going around, because I think those are one thing that people think of a quick fix to losing weight. Yeah. And unless you're using them properly, it doesn't work. It will work in the short term, but actually you'll end up unhealthy and you won't maintain those results.
Yeah. A lot of it comes down to consistency. So I suppose that's the same as even with injectables, whether it be fillers, whether it be the toxins, whether it be the treatment plans that you provide. It's not just have it done on a Monday and then that's it. You don't need to have it done ever again. I'm assuming there's a level of consistency and upkeep that has to be maintained. Botox and fillers, what's the usual frame for those?
So your Botox, we generally say to people come every 3 months, so around 12 weeks, 3 months. For Botox, fillers, it kind of depends on the area. So if it's areas that move, so around sort of the lips, the nasolabial folds, things like that, because your muscles are constantly moving, they are going to slowly break down that filler. You might be getting about 9 to 12 months out of them. Other ones, deeper fillers, cheek fillers, jaw fillers, tend to last longer, which is why we're seeing a lot of people who have had fillers for years are getting poor advice off, and they keep going back every 6 months for fillers. They're getting a bit blind to the results of it. Their injectors are still injecting them, and you get a lot of spread because the fillers won't break down. They will over time, but it's about little and often. And things like lip fillers, I'll tend to say to people, have your first treatment, have a mil, maybe have another half in 6 months, get to the size and shape you want your lips to be, and then you've maintained that with a half mil every 9, 12 months. Yeah. Otherwise, you're just going to get those sausage lips that look horrible.
Yeah, and that comes into, because we did have Dr. Frank talking about, I think it was Mounjaro, because obviously you've got the Ozempic, you've got Mounjaro, you've got Wegovy, there's lots of different ones. And he was saying, it's not a case of going straight for a super, super high dosage. It's slowly in increments. And yes, it can work if used correctly, if used in the right dosages. But some people are just going for these massive extremes and not realizing that they could actually have detrimental effect as opposed to a positive. What do you do if someone walks into you and says, right, I want this, and this, and you disagree with what they say?
I have had it. I've had it a few times where people have come in for certain things. I've had a message, an Instagram message, how much for 2 mil in my lips? A message back, look, you don't need 2 mil in your lips. Come in, let me see you. We'll probably start with 1. If in a month or two's time you come back and I'm wrong, we'll add a bit more. But let's see. I never heard back. I've had people who've had fillers, and again, I've had to tell this person, this was years ago, I said, look, I can't keep seeing this person because she was coming into me for fillers. I wouldn't then put more in, but was going somewhere else a month later, somewhere else a month later, somewhere else a month later. And in the end, she presented at somewhere I was working at the time with sort of numbness and tingling down her face as a result probably of a bit of a nerve injury from fillers. And I just said, look, I can't keep seeing you. No. This isn't okay. And I think it's really important for practitioners to know that. I think a lot of them do, but I think a lot of people, I'd like to think there's a minority, but I still think it's a significant minority, will still prioritize money over the patient safety element. Yeah.
Which is sad. And we go back to that thing of it being completely unregulated as well. A lot of people are just seeing it for pound signs and potentially not looking after the client's best interest. So it's nice to know there are still people like you out there that would turn somebody away if they were going to do something that would be detrimental to their face. Apologies for interrupting this podcast, but I need to ask a favour. If you're enjoying this podcast so far, then please hit that subscribe button right now. I'll be straight up and honest that I want to see this podcast grow and flourish into something that I'm really proud of. And the only way that I can do that is with your help. So if you've ever learned anything useful from these conversations, then please return the favour by liking, rating, subscribing, and maybe even sharing it with your friends. Thanks very much. Let's get back to the episode. Biohacking.
Yes.
Where do you stand on biohacking? See this word everywhere.
Yeah.
Alyssa's right into it. I just learn as I go. What are your thoughts?
I think biohacking is just a buzzword on TikTok that is getting people to look at videos. So it's everywhere, like you say.
Yeah.
And I think it can be a little bit intimidating for people because they don't know what it means. And it sounds like something fancy. It almost sounds something very scientific and a bit almost scary. I don't ever want to do that. And it's basically just optimizing your body's health. And a lot of the time it's using things that are quite easy to do and probably all do without realizing. So one of the easy ones, if you think about, people always say when it's weather like this today, people feel miserable. They don't want to get out of bed in the morning. It takes them ages to get out of bed. They feel tired. They go, can't be bothered. I'm not motivated at night. You just want to get under a blanket and watch TV. But when it's sunny, they say, I just feel better. As soon as the sun's out, I feel better in the morning. I've got more energy. I get the house tidy. I feel good about myself. I've got loads more energy and I go for a walk with the dog. And it's that sunlight. It's actually, it's a biological thing that's going on for thousands of years. The sunlight hits your body, hits your eyes. It regulates your circadian rhythm. It produces vitamin D. You do feel better. You do feel healthier. So one part of biohacking is just to be in the first 30 minutes being awake, try and get direct sunlight into your eyes for 10 minutes. Just try and go and stand near a window, go outside, be in the sunshine. Things like that, things like making sure you're optimizing your sleep. So, not being on your phone, scrolling just before bed. Things like intermittent fasting is a great one. Everyone can do that. So ideally, eat within an 8-hour window and starve for 16 hours. Mm-hmm. If they've been already doing it now, they can start introducing it slowly by just knocking back their breakfast by half an hour or an hour every week until they get to that 8-hour window. So things like that are dead easy for people to do. There's more advanced things, so red light therapy beds and things like that to boost collagen. But actually, I think people are put off when they see those kind of more expensive, more high-end kind of treatments. And there's very simple things that people can do.
We often, in the month of January, will see a sudden flurry of messages from people saying, oh, I've really enjoyed the supplement. It's doing me wonders or whatever, but it's January. I've got to prioritise other things right now and I'm feeling a bit meh. So I'm thinking I'm just going to cancel this month's subscription and go on the sunbeds. And I'm like, that's because your body is just craving sunlight. Yeah. We talk a lot about seasonal affective disorder on the Elle-Sera channel because I was very skeptical that it even existed. I'm quite a positive kind of like Pollyanna vibe person. I always like to see glasses as half full. And it's taken from my conversations with our customers to realise that is seriously an issue when it comes to the winter months, where someone can be having the best experience ever. The supplementation, their diet, their nutrition, their general wellness is optimised and great, but they're just struggling to get out of bed. They are not wanting to have rough conversations at work. They're finding their partner to be really aggravating towards them and they just can't understand why. And it was through doing quite a lot of research for Elle-Sera, finding that seasonal affective disorder affects a lot of people. And like you've just said, the smallest change in the way that they live their day to day, making sure that they get outside, have some fresh air. Fresh air is really underrated. It's also fantastic for their endorphins, a little bit of exercise. People don't want to do that because it's freezing and they just want to stay in. But for me, the biggest one was caffeine. People tend to consume a lot more caffeine during the winter months, and then it has a knock-on effect on anything of a supplementation basis. And I'm assuming anything of a skincare, general well-being as well. Do you find a lot of negative impacts of caffeine and alcohol and things like that?
I think everything in moderation is okay. Yeah. So again, you can say there are people who are doing this biohacking thing to the extreme, particularly over in the States where they have no caffeine, no alcohol, no processed food whatsoever. And I think it's very hard to do that. And actually, I think you've got to find that happy balance where it works for you. Caffeine, I have a coffee in the morning. Caffeine in the first 90 minutes of waking up is pointless, by the way. If you have a cup of coffee in the first 90 minutes of waking up, it does nothing. Caffeine's an adenosine blocker and your adenosine doesn't start to build up until after 90 minutes. So don't wake up and go, coffee machine, have it later in the morning. But anyway, so I think caffeine, I think having it after a certain time in the day, so having it in the afternoon can affect sleep in the evening. Alcohol and smoking are big ones. Again, I suppose smoking, there's no sort of moderation. Alcohol, arguably, there is an agreed upon limit that we feel is safer. And sticking to those limits is beneficial not only for your health, but also the way you look and feel. So back to collagen, both smoking and alcohol will destroy your collagen levels. Smoking anyway, alcohol in excess will destroy your collagen levels. Also, it's really difficult to lose weight when people drink alcohol. Even if they drink alcohol that is, low, you go, I'm going to go gin and slimline tonic or vodka and slimline tonic or whatever. The fact that your liver's got to process that alcohol means it isn't doing anything else. So it's not processing your fat. It's not doing anything like that. It's not regulating anything. So actually what happens is you lay down fat in and around your organs. So in your liver and around your organs, because your body just wants to get rid of the alcohol because it's a toxin. So it does have a negative effect on a lot of things.
Yeah. It's one we get quite a lot of, they'll say, everything's been working fantastically for the last 6 months. I'm like, yeah, how much champagne and Prosecco did you drink over Christmas? Yeah. Oh yeah, I didn't think about that. And the sugar that's in there as well.
Everyone does. And it's okay.
Yeah, absolutely.
As long as you've got that insight to it. And, it also makes you feel a bit rubbish after, a few days. So when people feel sad in January, you've overindulged, you've put on a bit of weight, everyone puts on a bit of weight over Christmas, you haven't slept very well, you've not been taking your supplements, and you're feeling a bit sad, and that's okay. As long as you accept that and you know it's coming, then that's okay. But I think when people don't know the impact it has, that's when it causes problems for them.
Yeah. Potentially the biggest factor that we speak about at Elle-Sera at this moment in time, and it's probably a good one to talk about right now because we've got a great event coming up, is menopause. And menopause, people go, oh, well, I'm in my 30s, I don't need to talk about that yet. But actually, the best bit about this is all the information that's coming out now about how you can improve your menopause experience, and you should be digesting it when you are in your 30s, 40s, and then on. What are the effects of menopause generally when it comes to skin wellness, general health that you found?
So for skin, the most obvious one is the loss of collagen. So 30% of your collagen, whatever was left, 30% of your collagen goes within the first 5 years of menopause. So people start to see skin laxity, fine lines and wrinkles, just signs of aging in the skin. Because of the psychological impact of going through menopause and people starting to feel like they're feeling older, then they also look in the mirror and they feel like the skin looks older, then it's got a real big impact. And then not just skin health, it's your health and well-being. Your bones can thin if you're not optimizing your diet. You can lose muscle mass. And psychologically, people can really suffer with symptoms of the menopause. And often, one thing I've found a lot is, it's not really my area, but where I work, we have people I work with who can help with this, is the impact on relationships. So when there's a lot of studies that have kind of shown that when you look at people who've had divorces in the 50s and whatever, when you look back and ask them 5 or 10 years later, do you think now, looking at it, the menopause was a contributing factor to you and your partner splitting up? And they often say yes. So I think there's a big psychological element as well.
It's really hard hitting on partners. We get quite a lot of emails from partners, and they're the people that I really want to help, because they'll say, my wife's clearly going through something. I don't particularly know what it is. We're not by no means menopause specialists, especially when it comes to emotional sides of things, but we can signpost. But it's lovely now that you are starting to see more partners want to get involved in that journey and want to help and want to understand what they're going through. So I'm really glad that you brought that up, because it's always really interesting to hear from a male perspective as well. And, with gynecology as well, I assume that you see quite a lot of women going through menopause that have issues gynecologically as well. I would kick myself if I didn't ask you. We get a lot of questions when it comes to vaginal dryness during stages of menopause and low libido. Why is that? Why is it more prevalent when people are going through menopause?
You basically you lose your estrogen level. So normally, pre-menopause, you've got your ovaries, they're producing estrogen and progesterone, and that's in relation to hormones coming from the hypothalamus pituitary in the brain that are telling your ovaries release these hormones, and you get your cyclical hormone release, causes your monthly cycles, and you ovulate. And when your ovaries start to get tired and start to run out of eggs, the hormones higher up start to really ramp things up, and you get the hot flushes and things as a result of that. But your ovaries can eventually run out of eggs, and then they just switch off. So your estrogen and progesterone levels are depleted, and it's your estrogen primarily it's responsible for things like or the loss of estrogen that's primarily responsible for things like vaginal dryness. And I think what happens in that case is people go to the GP. GPs are overstretched. You've got a 10-minute appointment, if you manage to get one. And you want to talk about everything that's going on. And they go, here's a cream, use this cream. And it might work for some people, but some people either want to avoid hormones or they've got other bits going on they need to discuss, and it doesn't always work. So I think I'm doing quite a lot of work at the moment around that, not in my hospital work, in my sort of private clinic work, around sort of how we manage those symptoms a bit better.
And how would you manage those symptoms a bit better?
So hormones are still there if somebody wants hormones. If somebody needs hormonal treatment, particularly if there's multiple things going on, hot flushes, night sweats, dryness, all that, then fine. It may be that hormones are beneficial, low dose, short period of time. But if it's something else, like if it's vulvovaginal atrophy is one of the most common symptoms that people come into the GP with or to the hospital with in menopause. They get dryness, they get itching. As a result of that, they can present as just having problems with partners because they're no longer intimate with each other. So there's a lot of issues there. So if people want to avoid hormones, there's things like the polynucleotides we mentioned earlier, which we use on the face for boosting collagen. We can do that in the vaginal tissues as well. That can improve collagen elasticity, improve hydration, improve blood flow to the tissues. It's all those things you lose in menopause that are put back with those treatments. That's a brilliant non-hormonal option. The other options are there's a machine that we're using currently in the clinic that's called Caress Flow. So it's a relatively non-invasive and non-hormonal treatment. We use high concentration oxygen mixed with low molecular weight hyaluronic acid. It's a 15-minute procedure, very, very straightforward, and directly treats the vaginal tissues. The oxygen is great for improving the metabolism of the cells. The hyaluronic acid hydrates the tissues. So usually people have about 5 to 6 treatments, 15 minutes each. And the impact on symptoms is massive. So most symptoms, so your vaginal atrophy, over 80% of people say the symptoms have improved. Itching, again, around the 80% mark, have improved. And actually, you then only need maybe one treatment every so often. So it's a really good treatment. And I think a lot of people, there's not many, we've got one in Manchester, we've got one in Cheshire, one in London, and I believe somebody else has one in Bristol area. But it's really popular on the continent, not so much here. But I think that's going to be a real game changer for women who are going through these symptoms and actually want to try and avoid hormones where they can.
You talked about a lot of tech there. No, I'm interested in technology. It just seems to be able to do everything at the moment. So you just talked about 2 pieces of tech there that you're using in your clinics. What are some of your other go-tos? What's the new up-and-coming AI technology? What is it that we should be looking out for?
So technology in the clinic, I think, I'll talk about AI in a minute. I think from one of the biggest things I've found really beneficial in the clinic is I've got an ultrasound machine. So from the aesthetic side, so the facial aesthetics, I've invested in an ultrasound machine from, my one's from UltraX. It's a relatively expensive bit of kit. So if you're a one-man band doing these treatments, it may not be massively beneficial, but actually they're fantastic for being able to visualize the tissues in the body before you inject. So if you're doing a masseter Botox injection, which is to slim the face, you often find that people come in and if they've been done poorly, well, I've got a droopy smile because I've injected the wrong muscle. If you can visualize it with an ultrasound, you know exactly where you're injecting. If you're doing fillers, you can check where the blood vessels are before, so you can really minimize the risk of vascular occlusion. And if you're doing a dissolve, so for somebody who's had silly amounts of filler and they've migrated and needs it dissolving, the old-fashioned way of doing it is just get your hyalase enzyme, inject it everywhere, and it will dissolve all the filler and all your natural hyaluronic acid, which will make your skin dry and crepey. And if you can do it under ultrasound guidance, you can visualize the pockets of filler, go in directly and inject that. So you're using less product, which causes less side effects and doesn't have the same effect on your own hyaluronic acid. So ultrasound massively has really changed the way I practice. AI, people have asked me this before, where is it going to work in the aesthetics industry? Personally, and I'm sure there are great software programs out there, personally, I think probably in sort of day-to-day running the clinic, automated emails, social media stuff, I think the advertising and the logistics of the clinic, definitely. actually, doing facial assessments and mapping and all that. I think there's a reason why it's sort of a combination of art and science. You've got to be able to look at the patient yourself and make that judgment. I might be proven wrong, but I don't think there's going to be an AI solution which is going to replace the practitioner's eye.
I still think people buy people. I still think people need people. Just quoted a musical there. But we get that a lot as well. AI is everywhere. So automation for emails and social media and ads and content and everything gets chat GPT'd to the point where everything is one and the same. So when someone's just got something off chat GPT, there's nothing personal there anymore. So I'm with you. I do think that people that will be at the moment, AI is like the norm, is the new norm, but actually it'll be a really like positive experience when people actually get a personal email. I know we get it quite a lot. They're like, oh my God, I can't believe that you took the time to respond. And it wasn't just an automated response. Chatbots do my head in. I can't bear it. The time that ever happens to Elle-Sera, I'll roll over and die.
People don't want it, do they? Like I've still done all my social media and things. It's getting a bit hard work now to be doing it at the same time just because it's busy. But even if I do eventually give it over to someone and let them do the social media stuff, I still want to be in charge of the messages, because I feel when someone messages me, they don't want to speak to a bot or something. Oh, here, booking on this system. They want to speak to me and say, what do you think I need? These are my problems.
Yeah, absolutely.
And I still think that's important. I've got a little out of office thing that says it might take 24 hours because I'll take a while to get back to you, but I'd rather do that than have an automated message that isn't in any way personal to that person. Yeah,
I'm never going to be Amazon Prime. I'm never going to be that quick, but at least you're getting a personalized service. So we talked then about, we've done biohacking. The other big buzzword at the moment is longevity.
Yeah.
Loving that word, longevity. Where does longevity come from in an aesthetics general wellness stance?
Yeah. So again, it's been out there for ages, but people have kind of jumped on it a little bit now. I think in the States, longevity medicine has been a sort of a subspecialty of medicine for years. Like we're talking 10, probably 20, maybe more years. But it's coming over to the UK now, and I think it's great that it is for a number of reasons. One, we all know with the healthcare system being as it is at the moment, it's very difficult in the healthcare system, and I know because I work in it, to be able to properly do preventative medicine. So it tends to be, it's very good at being reactive. If you break a bone, if you get an illness, you turn up at A&E, you will get treated and you will get fixed. But why don't we try and prevent those things from being a problem in the first place? And that used to be the role of the GP. GPs are swamped. They don't have time to do that necessarily. So that's why I think longevity's gaining a bit of traction in the UK. And it's just all about optimizing your life, optimizing your health so that you can live a longer and healthier life. And it all comes down to kind of patient education and some little tweaks along the way. So that's really what got me properly interested in the aesthetics thing when the longevity started to come into play. Because until then, I'd kind of always gone, it's a balance. I do aesthetics, I do my hospital work. But being able to combine the longevity with the aesthetics is massive. And so we started off actually with, I feel there's a lot of education out there for people now. We're probably in a position now where there's more information out there than ever before, but people don't know where to go and get it. So you just see things on TikTok, like we talked about the supplements, you go, that must be good because I've seen it online, but how do people know? So me and a colleague of mine, Dr Keiron, had a chat about this and said, what do we need to do? So we decided initially it started off as a podcast. We'll do a podcast talking longevity, and it will be a resource for people to go to learn about longevity stuff, biohacking, aesthetics treatments, but all evidence-based things. So they're not just getting nonsense online, they'll learn stuff. We started that, and then we went, well, what happens next? Like, what if they want to go and see somebody? So we said, okay, we'll start the clinic, the Talking Longevity Clinic. So we put that together. And that's where we've got a few places now, Manchester, Cheshire, London. And then from there, we thought, well, it can't just be us. There must be other people who want to do this. So then we've kind of bolted on the education side, which is training other people how to do it. Because whether you're a prescriber or a non-prescriber, whether you're an aesthetics practitioner or whether you're another sort of affiliated thing like a personal trainer or a dietitian, you can implement longevity medicine into your clinics and actually improve the health and well-being of your clients and get them better results in whatever you're trying to achieve for them. So I think longevity is massive. I think it's it is a bit of a buzzword, but I think it's here to stay now. And I think we should all kind of embrace it and integrate it where we can.
I love to end these chats with something of an uplifting or an educational manner. Yeah. And so I want to put this question to you because I know you're going to answer it really eloquently and beautifully. Aesthetics. What is aesthetics 5-10 years from now? What do you think?
I think it's going to be, as I said, Botox and fillers, I think still going to be there. I think there's going to be more push, as there is already, on collagen banking and collagen production. So using things like polynucleotides, PRP, to do that, using combined treatments. So fillers to replace volume loss and PRP to produce the collagen in the skin that we need. I think longevity and regenerative medicine are going to be part of that. I think it can get bigger and bigger. I think it can be really exciting. So yeah, I think it's an exciting time, and I think we're just at the start of it now. I think it'll just keep getting better over the next few years. So yeah, we'll see how it goes.
Looking forward to that. For anybody that wants to reach out to you, you've got a wealth of knowledge in so many areas, and I know that there's going to be people that will want to speak to you further. How do they reach you, Keiron?
Yeah, so probably the easiest way is Instagram. So it's Dr Lord _. Also got a Facebook page and a website, which is drlord.co.uk.
Fantastic. Do also have to stress as well, if you're like me and you're dyslexic, you may struggle with Keiron's name because we've now realised that Mum didn't know I before E.
No. Mum spelled my name wrong. And yeah, when I was a kid, high school. So my name is Keiron. Should be I before E, shouldn't it?
Yeah.
And when I was a kid at high school, Mum said, you can change it by default if you want. Bearing in mind, she told me she'd had this name plan for years before she was even pregnant. So you think you'd have checked. But anyway, I said, oh no, don't worry. I like it. It's unique. Not really thinking that I'd go into a job and a career where people might need to find me by spelling my name on Google. So yeah, not ideal. But yeah, there we go.
I learned the hard way. And I'm sure everyone that's listening to this will know as well. So it's not I before E, E before I. Keiron, thank you so much for being here. It's been a pleasure.
Yeah, great. I've enjoyed it. Thank you.